The problem with joint pain after 60 is not the pain itself. The pain is just the signal. The real problem is the inflammation sitting inside that joint every single day, breaking down cartilage quietly, narrowing the space between bones gradually, and turning what started as occasional discomfort into something that never fully goes away. Pain tablets manage the signal. They do not touch the problem. Most people over 60 have been managing the signal for years, while the problem underneath it continues unchecked. And every year that passes without addressing the inflammation directly is a year that moves the joint closer to the point where a surgeon's opinion becomes the next conversation. This video is about the inflammation, about a specific 2-ingredient preparation using aloe vera and one kitchen ingredient that most people have never thought to combine with it, that targets that inflammation where it lives, inside the joint itself, and does it in a way that no single ingredient can achieve alone. Let me start with the one thing most people with joint pain have never fully understood about what is happening inside their body. Because once you understand it, everything else in this video makes sense immediately. Inside every joint is a cushion, a layer of smooth, slippery tissue that sits between the bones and allows them to glide against each other without friction. In a healthy joint, this cushion is thick, resilient, and well fed by the fluid that surrounds it. That fluid is what keeps the whole system working quietly, without pain, without stiffness, without the grinding sensation that so many people over 60 have started accepting as the soundtrack of their mornings. In a joint under chronic inflammation, that cushion is being eroded, not quickly, not dramatically, slowly and consistently, the way a river gradually wears down the rock beneath it, until one day what was smooth becomes rough, what was padded becomes thin, and what was painless becomes something that follows you through every step of every day. The medical name for this cushion is cartilage, and cartilage, once lost, does not grow back. That is the part most people are never told directly. The cartilage you have today is the cartilage you have to protect. There is no pharmaceutical, no procedure, and no supplement that will rebuild what chronic inflammation has already destroyed. What can be done is stopping the destruction before it goes further. That is not a small thing. That is everything. I am Dr. Natalie Brooks, and I want to be direct with you about something that rarely gets said clearly enough. The path to joint replacement surgery for most people does not begin with one dramatic injury. It does not begin with a fall or an accident or a sudden catastrophic event. It begins with years of inflammation that nobody took seriously enough, early enough. The discomfort was managed. The inflammation driving it was not. Appointments focused on the pain score. Nobody addressed what was causing the score to keep climbing, and by the time the imaging showed bone pressing against bone and the surgical referral was written, the window for meaningful non-surgical intervention had been narrowing for years, sometimes a decade or more, without anyone naming what was happening or offering what could have slowed it. You may still be in that earlier window. Most people watching this video are. And that is exactly why this conversation matters right now. Pain tablets, including over-the-counter anti-inflammatory medications that millions of people take daily for joint pain, work by blocking the signals the body uses to communicate that inflammation is present. They are useful. They are often necessary. But they do not reduce the inflammation itself. They lower the volume on the alarm without doing anything about the fire that triggered the alarm. And taken over months or years, which is the reality for most people managing chronic joint pain, Many of them carry increasing risks for the stomach lining, the kidneys, and the heart. Risks that tend to grow alongside the very age group that needs the medication most. This is not an argument against using them when they are needed. It is an argument for also addressing what they are not addressing. What a growing body of clinical research is pointing toward is that the most effective approach to joint inflammation after 60 is not one that simply quiets the signal. It is one that reduces the underlying inflammatory activity in the joint tissue itself. And the combination we are covering today does exactly that, through two separate mechanisms working at the same time. Aloe vera has been used on painful and inflamed tissue for thousands of years. Most people know it as a remedy for sunburn and skin irritation, and they are right that it works remarkably well for that. But the reason it works is the same reason it has value for inflamed joints. The gel of the aloe vera plant contains over 70 active compounds, several of which have been specifically identified as anti-inflammatory. Not in a vague general wellness sense, in a measurable, documented sense. A double-blind clinical trial applying aloe vera gel to knee joints confirmed pain reduction and improved joint mobility compared to placebo. A separate study found that when aloe vera gel was used as a carrier during joint treatment, it not only contributed its own anti-inflammatory properties, but enhanced the absorption of whatever was carried alongside it. That second finding is what makes the combination we are building today work as well as it does. Applied to the skin over a painful joint, aloe vera does three things simultaneously. It reduces the inflammation visible at the surface, the redness, the warmth, the puffiness that surrounds a chronically painful joint. It creates a moist, receptor-ready environment that makes the skin significantly more open to absorbing what is applied alongside or over it. And it delivers its own active compounds into the upper layers of the surrounding tissue, where much of the inflammatory signaling originates. The clinical study using aloe vera in joint treatment did not find modest or borderline results. It found pain reduction and improved mobility that were measurably superior to the placebo group. That is a meaningful finding for something most people associate only with sunburn relief. This is where turmeric enters the conversation, and the evidence behind turmeric and joint inflammation is some of the strongest in natural medicine. Turmeric contains a compound called curcumin. You have probably heard of it. But what most people have not heard is the scale of the evidence that has now accumulated behind it for joint pain specifically. A comprehensive review published in 2024 that pulled together the results of 17 separate randomized controlled trials, the most rigorous type of medical study, found that turmeric preparations significantly reduced joint pain across all 17 studies. Every single one. A specific trial studying adults with knee pain found that the group receiving turmeric achieved a 30% reduction in pain scores compared to placebo, reaching what researchers consider a clinically meaningful threshold, not a marginal statistical difference, a change that people actually felt in their daily lives. Another trial found that when turmeric was combined with standard pain medication, the combination produced a 70% reduction in pain compared to medication alone. The turmeric was not replacing the medication. It was multiplying its effectiveness by addressing the inflammation the medication was not fully reaching. Now here is the specific mechanism that makes mixing turmeric into aloe vera gel such a sensible idea, explained simply. Curcumin from turmeric is fat-soluble. That means it needs a vehicle to carry it through the skin and into the tissue where the inflammation is occurring. Applied as a dry powder on its own, very little of it makes it through. Mixed into a gel base that opens the skin surface and improves penetration, significantly more of it arrives where it needs to be. Aloe vera is that vehicle. Its polysaccharides, the long-chain compounds that make the gel viscous and smooth, act as a natural absorption enhancer. They carry the curcumin through the surface and into the inflamed tissue below. At the same time, aloe vera's own anti-inflammatory compounds are already working at the surface level, calming the external inflammation that aloe vera reaches easily. Turmeric is working deeper, inside the joint tissue. 2 ingredients, 2 levels, 1 preparation. There is one more addition that doubles the effectiveness of turmeric, and it belongs in the preparation every single time: black pepper. A small pinch of ground black pepper mixed into the preparation increases the body's ability to absorb and use curcumin by a margin that the research has measured precisely. Without black pepper, curcumin is notoriously difficult for the body to absorb. The compound is broken down quickly before meaningful amounts can penetrate into the tissue and reach the inflammation driving the pain. With black pepper, absorption rises dramatically. The natural compound in black pepper responsible for this is called piperine. It works by slowing the breakdown of curcumin long enough for the tissue to absorb it properly. The result is not a modest improvement. Studies measuring this directly have found that the combination absorbs at a rate far beyond what curcumin achieves on its own. Skip the black pepper and the preparation is working at a fraction of its potential. Add it, and the difference in what actually reaches the joint tissue is substantial. If this information is new to you and you want to continue receiving this kind of specific, evidence-based guidance for health after 60, subscribe to this channel. It costs nothing and ensures you see new videos as they come. Now, exactly how to prepare this at home, because preparation matters. Get it wrong and the benefit sits on the surface. Get it right, and it reaches the tissue that needs it. You need 3 things: fresh aloe vera gel, turmeric powder, ground black pepper. For the aloe vera, fresh is significantly better than bottled. If you have an aloe plant at home, cut a lower leaf, split it lengthways, and scoop the clear inner gel into a small bowl. If you are using store-bought aloe vera gel, choose one that lists aloe vera as the first ingredient and contains no alcohol, which would dry out the skin and reduce absorption. Into the gel, add 1 level teaspoon of turmeric powder for every 2 tablespoons of gel. Turmeric is bright yellow and it will stain fabric, so apply this carefully and protect any clothing nearby. Now add a small pinch of ground black pepper, a pinch only. Its job is absorption, not flavor, and a small amount is all that is needed. Stir the 3 ingredients together until the turmeric is fully incorporated and the gel has taken on a golden yellow color throughout. The consistency should be similar to a smooth paste. If it is too thick, add a small additional amount of aloe vera gel to thin it slightly. Apply this paste directly to the painful joint. Use enough to cover the whole area of discomfort, not just the sharpest point of pain, because inflammation in a joint is distributed through the surrounding tissue and not concentrated in one precise spot. Use your fingertips to press the paste gently into the skin with circular motions. Do not rub aggressively. The goal is to encourage absorption, not friction. For an even stronger effect, Apply a warm compress to the joint for 5 minutes before you apply the paste. The warmth slightly opens the pores in the skin and increases blood flow to the area, both of which improve how deeply the preparation can penetrate. A warm, damp cloth held against the knee or hip or hand for 5 minutes is enough. The joint does not need to be hot, just comfortably warm. After removing the cloth, apply the paste immediately while the skin is still warm. That window of increased openness is when the aloe and curcumin combination can reach the deepest into the surrounding tissue. Leave the paste on the joint for 20 to 30 minutes. Do not rinse it off early. The first 10 minutes is the aloe vera doing its surface work. The second 10 to 20 minutes is when the curcumin is making its way into the deeper tissue. Removing it too early cuts that process short. After 30 minutes, rinse the area gently with warm water. Apply this preparation twice daily, morning and evening. The morning application addresses the stiffness and inflammation that peaks after the joint has been compressed during sleep. The evening application works overnight, when the body's natural tissue repair processes are most active. Give this preparation 4 to 6 weeks of consistent, twice daily use before forming a final opinion on what it is doing. This is important to say clearly because the pattern most people follow with natural preparations is to try them for a week, notice no dramatic change, and conclude they do not work. Joint inflammation does not build in a week, and it does not reduce in a week. What each application is doing is reducing the level of inflammatory activity in that joint tissue by a small margin. Those margins accumulate. After 2 weeks, the baseline of daily discomfort may feel slightly lower. After 4 weeks, the gap between pain episodes may have widened. After 6 to 8 weeks of consistent use, many people who stay with the preparation describe a joint that feels qualitatively different to live with. Not cured, not pain-free, but quieter, less reactive, more manageable on the average day. If you are currently taking blood thinners, have a known allergy to any plant-based ingredient, or are managing a specific diagnosed inflammatory condition, speak with your doctor before beginning this preparation. Turmeric at this concentration is generally considered safe for topical use, but individual responses vary and your doctor knows your full health picture. Joint pain after 60 is a warning that deserves to be taken seriously, not because surgery is inevitable, but because the gap between where the pain is now and where it could go without intervention is not fixed. It is not a predetermined destination. It is a direction, and direction can be changed. The inflammation inside that joint is responding to inputs every single day. What you eat, how you move, how much rest the joint gets, and what you apply to it are all inputs. This preparation is one of them. It is not the whole answer, but it is a specific, targeted, evidence-supported part of the answer that most people with joint pain after 60 have never been offered. The signal was telling you something. Now you know what to do about the problem behind it.